Welcome back to Melisia Talks, where we talk all things uniquely you. In today's snippet episode, I will be looking to focus on one particular thing, although we know for the month of February, there are many different things that we look to celebrate and also bring awareness to. In this episode today, I am looking to bring awareness to cardiovascular health or heart health, especially as it relates to women. So, February is also called outside of Black History Month, and of course, it being the month of love with Valentine's Day, it's also called American Heart Month. And again, it looks to raise awareness about heart disease and look to encourage everyone, but especially women, as it relates to focusing on cardiovascular health and doing all that we can to look to decrease our risk factors, right? So, when it comes to heart disease itself, it is a leading cause of death. But for women, it is the leading cause of death in the United States. And so, this is information that has been researched from the CDC. And one of the things that it is said that could lead to cardiovascular diseases is having a high blood pressure risk. And so when it comes to having high blood pressure or hypertension, it can put someone at a significant risk factor for developing heart disease and even a stroke. And so we know that having a stroke or a CVA or brain attack, we may hear it called, is where we are potentially losing blood flow to an area of the brain, or we may have an actual bleed that has taken place within the brain. And so, overall, now moving back to the heart aspect of it all, what are some preventative strategies or various things that we can look to reduce our risks for developing cardiovascular diseases, which could potentially lead to an actual stroke? Well, one of the main things is your diet. Healthy eating plays a huge part in decreasing that risk. And so every day looking to incorporate a variety of foods that are nutritious, right? That could help, of course, lead to a decrease in weight, which could lead to a decrease in high blood pressure and even that risk for developing cardiovascular diseases. And so we do have various myplate.gov, I would say. So you can go to myplate.gov, which is a website that allows you to see the amount of servings that you should be incorporating within your meals. And that, of course, helps with determining, some ways to eat more healthy as it pertains to your diet. And of course, that leads right into maintaining a healthy body weight. And so, with that, we do know that the body mass index is utilized to be able to help determine, but we know that every body, B O D Y, is different, right? And so, we really have to ensure that we are getting with our providers to help us understand our body and what is considered to be a healthy body weight for us. And so, again, keeping your weight under control along with avoiding smoking. I cannot stress this enough. If you smoke, the sooner you stop, the more time you are giving yourself as it relates to your life. Overall, we know smoking can lead to atherosclerosis, and that again can lead to that plaque buildup within your arteries, which can lead to heart disease. And so we want to, again, if you can, steer clear of it if you don't have, are doing it already. And then if you are, try to quit as soon as you can. So, maintaining an active lifestyle, we always look to recommend that we at least incorporate 150 minutes of some sort of moderate intensity exercise per week, right? And that's the minimum. And from there, of course, whatever you are able to tolerate beyond that 150 minutes. But if we can at least get in that minimum weekly, that is said to be able to at least help us with this process of decreasing our risks for hypertension and even cardiovascular disease. And then, of course, making sure you follow up with your providers. If you have a family history of, hypertension, if you have a family history of diabetes or even high cholesterol, those things should be checked up on and monitored regularly, right? And so making sure you are meeting with your healthcare providers, if not for your annual, at least twice a year. And then, of course, if you have any of these risk factors already, you should be meeting with your provider sooner than that. So again, making sure you are staying on top of your blood pressure, your blood sugar, and your cholesterol levels with your providers. Now, as it relates to women, and some of the symptoms that could be experienced if it happens to lead to a heart attack. We know those symptoms in women are a bit different from the traditional symptoms that we can experience, especially in our men. So for women, some of those symptoms could be shortness of breath. It could be stomach upset or GI upset, maybe jaw or arm pain, or even some back pain, but not like the classic chest pain that we can see experienced in our men. So we want to make sure that we are taking those things seriously, and even fatigue. I want to highlight that as well in women. Extreme fatigue is one of those things that could be seen also as a potential sign of a heart attack. And so we don't want to take those things lightly, especially if it's not something that you've been experiencing already. Don't take it lightly. Get followed up and see, of course, your providers as soon as possible. Now, I mentioned the cdc.gov already. There is a CDC toolkit that offers various facts and resources about how you can, look to raise awareness within your family, within your community, and of course, manage any potential heart-related conditions or issues. The resources are there. And so I want to ensure that you all have that information. And if, of course, you would like to get involved, there's always, various community groups within your city. So be sure to research that and get all of the information that you need and that is necessary. So this is Melisia Talks, where we talk all things uniquely you, nurse practitioner. And so, again, if you have any questions, have any concerns, be sure to follow up with your providers and, of course, research various information out there with cdc.gov. Until next time, bye.